Okay, and we're live. So good afternoon, everyone. Good afternoon. Good afternoon. Welcome to Thriving Thursdays. I am so excited to have you here as we enter June. I can feel summer coming on for real this time. I'm so excited to have you all join us for Thriving Thursdays. It's been such a wonderful, we started in February, we just been kept going. And it's so excited to have one of my colleagues and friends, Dr. David Zelaya, here with us to talk about his work and to just elevate him in the community. So really wonderful to have you. I'm going to do just a little bit of housekeeping comments first, and then we'll dive into our conversation. So for those who are a regular audience, thank you for coming and being here for us in this discussion. As you know, InnoPsych is an organization that's really charged with disrupting racial inequities in mental health. Our goal is to make it faster and easier for people of color to find therapists of color. And one of the things that we're really excited about is how we're really impacting and changing the conversation about mental health. Our goal is to make this conversation accessible, to help you in the audience, in the community, see us as people, to kind of demystify what happens in the therapy room. So you can see that therapy is not all the things we thought it was, right? We're really trying to shift that message about what therapy and mental health was, so that we can access healing, so we can obtain hope and really build not just for us now, but for the next generation. So that's our mission at InnoPsych, and thank you for being on this journey with us. As always, just share your name and where you're from, and drop where you're located in the Zoom, in the chat. And we always love to start with share something that made you smile today. And for me, I'll just share my son he had his 5th grade speech today, which he did. He had to study Michael Jordan. Well, he chose who he wanted to study. He studied Michael Jordan. So it's so nice to see him give his speech. And so that made me very proud mama today. So feel free to drop what made you smile today in the chat. And as always, if you have any questions, feel free to drop those in the chat along the way. So as I mentioned, InnoPsych, our goal is to make it easier and faster for people of color to find therapists of color. We have an amazing network of therapists of color across the country. Our directory is one of our signature products. So you can find a therapist there at innopsych.com, find a therapist. If you are a therapist of color, then we want to make sure that we are featuring you on our website. So please connect with us through innopsych.com, join directory, and we'll drop that link in the chat for you. But we have a very ambitious goal this year. We turned 1 year old in January 2021. We launched in 2020. And our goal is to bring 2,021 therapists of color into our network. And so we're going to need everyone's help to make that number. We are slowly climbing up there, but we are going to do it with your support and with your love. So if you know a therapist of color, make sure they are on our website, pass on the information. And if you're looking for a therapist of color, definitely make sure that you connect with us. The other thing that I want to share with you, we launched our blog this year as well. And so we have some amazing content that's on there. So again, our goal is to make sure that we're continuing to spread the message about mental health and wellness. We're giving away lots of nice tools and tips. This month we talked about, or actually in the end of May, we talked about mindfulness and how you can think about mindfulness practice and how to adopt that in your own practice. So please check out our blog. And we have some amazing products. I'm proud to be the creator of the My Time to Thrive Feel, Grow, Heal card deck. It features 72 cards that have mindfulness strategies, activities, prompts, quotes from POCs. It's really a tool to help you build your own emotional well-being toolbox and gain skills. It's something that you can use for yourself, you can use with friends and family. Again, these are great ways to open up conversations about mental health and healing. And then we're having a journal to come with that soon. So that's my little sales piece. Really wanted to just make sure you understand what InnoPsych is about and all the things that we're trying to do. And again, thank you for all your support. So I will stop sharing my screen, and then we'll have the lovely Dr. David. We'll start with him. And I'm so excited to have you, Dr. David Zelaya. I know him through our work in one of our state associations. And I'd really just love to get to know him and learn more about his journey. And, having this conversation, like our pre-show talk, I'm like, oh my God, there's so much I didn't know, right? So in those meetings, we get little snippets. So I'm so excited for everyone to meet you and hear what you're doing. So first question off the bat is, I always like to start with why. So what got you interested in mental health in the first place? Many of us, as we come from communities of color, mental health does not exist from our parents, right? It's not a career option. You're not gonna make any money, right? Yep. Like we have all these messages that turn us away from the field. So tell me about what got you interested in this field? And how did you have to navigate some of those messages to really kind of be at the place where you are, right? It's also not easy to get a psychology degree. You have to go through, college and then 5 years or more of graduate school. So it's definitely not something that's quick and easy. So tell us a little bit, what inspired you?
Yeah, I think for me, I think we all come to this work in a very personal way. And I think for me, having grown up in a very bicultural, binational way. So having grown up in Nicaragua and Guatemala, and then moving to the States, and then sort of coming into terms of my own queer identity, being a gay cisgender man, being Latino, Latinx, right? It was sort of trying to make sense of all my different histories and my identities. That I think psychology gave me the language to understand how those different pieces fit or don't fit together, and that if they don't fit, that's okay. But it sort of gave me an analysis and an understanding and sort of deeper appreciation for the different parts of myself, that I think that I don't know that I would have reached otherwise had I not come to psychology. I think so much of our work is so personal and grounded in our own experiences. So I think, right, sort of like the identity development and integration and different stages that we go through in our lived experiences. Like I really love sort of like how psychoanalysis talks about I hate the term ego splitting, but sort of like how your ego splits throughout time through different experiences. And so I think it's just given me a new language for my experiences. And it just kind of made, yeah.
You have to break down ego splitting first, because remember, we have a ranged audience. So some people like, what is that? So break that down for us.
Sure. So ego splitting, it comes from, and I'm probably going to butcher it, so apologies. But ego splitting is sort of the process that happens when you go through traumatic experiences or different life-changing situations, that sort of you have your sort of whole ego, but then sort of your ego kind of splits as a result of this experience, that sort of you're sort of less, not necessarily integrated, but sort of your ego changes over time. Sort of your sense of self, sort of who you are and sort of who you are in that place, I think kind of changes. So I think that's sort of a brief summary of ego splitting, but yeah, and I think psychology just made a lot of sense to me. It felt that I could make a change, sort of like looking around and knowing that there aren't a lot of other queer Latinx psychologists out there that are bilingual, bicultural. I think really spoke to the change that I'm able to make, hopefully.
Yeah, that's so powerful. And I love that you're not only, and people will find out, but you're not only kind of in your own bubble, you're really trying to have an impact on the field. And I love that you talk about your niche, right? As a queer, cisgender male who speaks Spanish, right? They're like, it's so, it's such a niche, but such application to a broader community. And some of you know that I work in a high school, and I work with, we're in an arts high school, and we have a very open and tolerant community. So we have lots of students who are out and open. We have faculty who are out and open. We have lots of students who are transitioning. And you talk about that ego split, and to kind of even break it down a little bit more, it's like, and you can correct me if I'm wrong, but the sense of we have students who are open and out at school, but not at home.
Yeah.
Right. And so there's this place that they have to hide, they can't be their full selves. And so you have to kind of split who you are. That sense of self gets fractured depending on the environment or who you're around, who you feel safe to be your full self with. Does that make sense? That, yeah. And so having model, you know, and lots of students as well look to psychology. You know, I think even for myself, there were definitely experiences that I had in childhood that I was kind of trying to figure out on my own. And I just always had a curiosity, right? I kind of loved puzzles, and I was more of an observer. So I observed people's behavior. So I'd never met a psychologist, but just got really interested in the field. Again, like you said, through my own personal experiences, and wanted to help, right? Wanted to like make a difference for other teenagers, so they would have an adult that they could trust to kind of navigate these waters of adolescence, right? And from an island, right, where they're very specific roles about children and their voice and how they express emotion. So I think you're so right. Like, so much of what often brings us to this work is our own personal experiences. So, so that's what inspired you. And so tell us about what's your day-to-day right now. One of the things we love to highlight is just showing mental health professionals in different aspects, right? Sometimes you have this very kind of limited view of what a therapist can do or what a psychologist can do. Because sometimes you'll only see them as in an office, right, meeting clients, but you have a very different kind of take on your career. So tell us a little bit about your path, your journey, and kind of what you're doing right now.
Yeah, absolutely. So I went to undergrad at Loyola University New Orleans. Yes. I got my PhD from Georgia State's University in Atlanta from a counseling psychology program. I did my internship or psych residency at Harvard Medical School and Cambridge Hospital, where I think that's truly where I fell in love with clinical work. I was part of the Latino mental health clinic. I was part of the gender and sexuality clinic. So that was really the first time that and it's wild that it happened so much later in my training. It was sort of the first time that I worked in different clinics where there were providers that looked like me, that sort of affirmed my different identities in a way that it hadn't been done before. So it just really empowered my work. And currently, I'm a postdoctoral research associate at Brown University in the School of Public Health within the Center for Alcohol and Addiction Studies.
Great.
And so sort of my day-to-day, it's busy, although you wouldn't see it's busy because I'm mostly in front of my Zoom computer all day, mostly sitting. But a lot of different meetings. So I'm currently working at a group private practice that's mostly focusing on LGBTQ like patient population. So most of my clients are queer, transitioning, people from sexual and gender minority backgrounds. So I see a couple clients through there. Then day to day, I'm mostly in a research capacity, so working on a couple of different projects. My current mentor is we just launched our large scale randomized clinical controlled trial with 4 different sites across the US. That's basically testing an alcohol brief intervention for men who have sex with men living with HIV. So I'm working with as a study interventionist there. I am also helping to develop an intervention around mindfulness for young men who have sex with men in terms of trying to decrease sexual risky behavior. So and then just working on some other different projects and papers and stuff. So
Okay.
Yeah.
Great. So I'm going to tackle the research first, and we're going to come
Sure.
back to the clinical piece. So tell us a little bit about what impact that you hope to have on the community and the clients that you're researching. How do you, like, what's the big goal? What's the, how do you hope what hope do you have for your research to kind of lend to our understanding about how to support and treat the populations that you're working with?
Yeah, absolutely. Before that, I kind of want to answer with a quote that I got from Dr. Annalise Singh, who's a amazing researcher and clinician and trans advocate. But she says, it's a quote by Lila Watson that says, "If you've come to help me, you're wasting your time. But if
Mm.
you've come because your liberation is bound up with mine, then let us work together." That I think
Ooh.
that's like just truly the approach I try to take in terms of working in research. I think for so long, research has been on the backs of marginalized communities, and so I think really trying to immerse the research in a way that is based in the community, sort of like using terms like culturally congruent.
Mhm, mhm,
Terms sort of culturally adapted gets a bit more complicated in terms of when we're taking one
mhm.
intervention, sort of trying to adapt it to another, but
Put it
rather
right.
creating those congruent interventions for and with the community. Um, and so I think with that, a lot of the work that we do is based with community members. So we bring in community members into our research um, program, sort of from start to beginning, to really make sure it's grounded in the lived experiences of what the community
Mhm,
needs and wants.
mhm. Oh man. Okay. So I'm gonna go deeper because this is awesome because there's, a lot of conversation, recently as we've really kind of, I think my generation, your generation are starting to challenge the status quo and how we were trained. And there's really a big pushback on research because research is kind of the gold standard, right? But we know who is often studied, who is
Yep.
left out of those research studies. And the model that you describe is not creating something in some lab and then implementing it on a group of people, but actually bringing the people in as they help you to think about what questions do you really want to ask. Who do you want to see? So that is, I just love that approach that you're taking, and that model I think is a model for the future.
Yeah, absolutely. Yeah. So one of the current studies we're working on right now is that as we start to develop our brief alcohol use intervention, we're also trying to expand it to transgender and gender nonconforming
Mhm,
people or gender
mhm,
diverse people.
mhm, mhm,
But a lot of the drinking norms that we have are normed with cisgender people, right? So, like for men, no more than 5 drinks; for cis women, no more than 4 drinks. But we don't
mhm,
really have those norms for trans people, right? And we don't really know sort of like the effects of transitioning and starting gender affirming treatment, like
mhm.
uh, hormone replacement therapies and stuff.
Right.
And so a lot of the work right now has sort of been really trying to bring in trans folks to understand sort of what they want to see out of a brief motivational
Mhm.
interviewing alcohol use intervention.
Excellent, excellent.
Yeah.
That's amazing. And just a question too, is that substance use, is that something that you see as a concern in the community, in the trans community? Um,
Yeah, yes. So we do know that the LGBTQ community broadly drinks more than their straight counterparts or their heterosexual
mhm,
counterparts.
mhm,
It tends to be higher for lesbian and bisexual women as well.
mhm,
And so it is something very sort of pervasive within the community that can be attributed to a number of factors, right? Whether that be coping with
right,
minority stress or discrimination or racism, heterosexism, right? So it's oftentimes a coping tool.
mhm,
Um, and so yeah, so it's definitely a health disparity
right,
within the queer and sexual and gender diverse community.
right. Thanks for sharing that. And I think part of our focus this month is really about highlighting those concerns within the LGBTQ plus community because we do have those kind of general stats around more mental health concerns, more
Yeah,
suicide ideation, more substance use, but really wanted to understand, like you're saying, what are the factors that are contributing to it. And I think for some, I have seen some, increase or high levels of substance use in the adolescent population. And
yeah,
I get part of that is the coping, right? Is the self-medicating. And I could see how that might lead into adulthood.
yeah, absolutely.
So I'm going to switch to the clinical piece. So one of the questions that I often ask my guests is, how do clients react when they first notice that you have an identity that's connected to them, right? So I remember like one of my first internships, I was in Mississippi, Hattiesburg, Mississippi, well, a little town outside of Hattiesburg, Mississippi. And, I come out to greet my client and she almost fell off the floor. She was like, oh my God, you're going to be my client. So excited to see a Black woman walk out and be the therapist for her child, right? So how do clients connect with you when they say, oh, this is a queer Latinx male that's going to be my therapist? Like, how do clients react to you?
It's interesting. Yeah. I'll never forget the first experience I had. I was doing an assessment sort of training rotation at a primarily Hispanic Latinx private practice. And I was starting to do the psychological testing case and sort of came in to do the clinical interview with mom. And I started to speak Spanish, and she just started crying. That she's like, I just can't believe that you speak Spanish, right? She was
Mhm.
undocumented, so transportation was an issue.
Mhm.
Trying to advocate for the child was really hard within the school system. Yeah. I think sort of breaking down Eurocentric white therapy is important to
Mhm.
do, because I oftentimes
Mhm.
I do tend to cry with clients, right? And I think
Mhm.
that's something that's sort of frowned upon within more white Eurocentric therapy spaces, but it's been some of the most powerful sessions I've had. I mean, I cry within
Mhm.
reason, like
Right. You're not taking over the
right,
session.
yes, but sort of like
They're
that,
handing you the Kleenex.
right, but sort of like really joining them in that moment.
Yeah, yeah.
And so, yeah, I'll never forget. I was doing my interview at Cambridge Hospital, and Angela Radang asked me a question. Like let's say you're seeing a patient. It was an ethics question, and she was like, let's say you have a patient come in. She's like a little old Latina grandma, and she wants a hug. What do you do?
You
Right.
hug her.
Yes, exactly, exactly, absolutely. So
Pre-COVID,
yes,
pre-COVID,
yes,
pre-COVID.
absolutely. To where but sort of I remember in that moment I was like, like coming from a very like white centric sort of training perspective, like
Mhm.
we don't hug clients, we don't, so like I think it's important to really work within the culture, otherwise we're just going to turn people away.
Right, right. And I'm so glad that, I mean, there's so much to unpack in that little section. So I'm going to start first with the crime with clients. And I think one of the, I think internships are why they're so important, because we actually kind of get to connect and understand like how we actually take what we learned in school and apply it. And I think for me, and I've said this before, I've learned the most from working with teenagers in terms of my own identity as a psychologist and being able to apply what I've learned in the setting in a school. Because again, right, we have these very restrictive things about what the therapist is, what they can and can't do, and teenagers break that down real fast. And
Yes,
if you're going to be, stuck up in this, they're not having it, right? And so I had to unlearn things I learned and kind of adapt. And I remember having a supervisor who says, you're gonna have to be more real. You're gonna have to like share things that you weren't taught to share
right,
in your traditional setting. So that was really powerful. And to have a supervisor
right,
who could say that, right, who can help me navigate that, is so important.
absolutely, absolutely.
Yeah. So crime with a client, right? Many of us were taught, like, you kind of have this sterile,
Yeah, absolutely.
facade.
Yeah,
And
and yeah, and I think
go
some of
ahead, yeah.
the messages around men and masculinity and
Mhm.
sort of modeling some of that and sort of breaking down those stereotypes, I think also helps to model that in a different way as well.
Right, right. And then the physical contact, right? Hugging a client, right? Like, they come in for that hug, you got to do it, right? Or
Yes.
else you said, right, they're going to say, like, what is up with this person? I can't trust them. They're not. One of the things that, so I've also been trained in forensic settings, and again, that's even more like kind of neutral person. And I've had to learn, I need a small talk with my clients, right? Because they're not about to, and it's this real fine dance, because the more you connect with them, the more they open up. But you're in this court setting, but you're not going to get any information if you don't allow them space to relax and just name kind of the setting and allow them to kind of judge for themselves what they want to share. So it is so important to be able to navigate those, again, to kind of shift how we were learned. And hopefully, more of us coming into the field, right? Because part of it is we represent less than 15% of psychologists in the field. And so how we're trained is dictated by people who are here and are leading those models. But the more that you're doing research that can inform practice, and the more that we're expanding that pipeline, we can start to shift those narratives about what a therapist is and how a therapist engage. We can renorm those.
Absolutely.
We have a comment here, a comment or a question. Tanisha says, my therapist as a teenager used to swear. I remember thinking, isn't that unprofessional? But I realized it made talking to her a lot more comfortable. It normalized the relationship. Yes, right. And so definitely really wanted to make sure that you are connected. And I have clients like that who come in, me personally, I'm not a person who swears, but my clients come in and, they'll let the bombs go. And, sometimes I'm like, all right now.
Yes.
But but they also get me, right? And I know like when I can do that. And sometimes it's just about letting them express, right? Is that there's no like aggression in that, what they're expressing. They're just kind of expressing what they're just saying what they need to say. So excellent. So so we kind of unpack the clinical work, unpack the research, and just again loving what you're doing. And so tell us a little bit about some of the work. I know you're pretty active at the national level in terms of also guiding policy. So tell us a little bit about that work that you're doing. And again, we're highlighting like, I think the beauty about being a psychologist and a mental professional is that we can tap into so many areas.
Yeah.
Tell us a little bit about the work that you're doing at that level and how that may impact policy and things like that.
Yeah, absolutely. So I've been lucky to get involved with the Massachusetts Psych Association.
Yes,
So
we reeled you in.
Shout out to MPA. And so with that, I am a co-chair for the Early Career Psychologist Committee. Shout out to my co-chair, Ellie Castine. And through that, we're really trying to focus on the experiences of early career psychologists, trying to advocate for them, and trying to make sure that our voices are heard within the field, right? Because oftentimes it's sort of, it's a lot to navigate. Sort of, you finish graduate school, you start to be a grown up for the first time, more so. Yeah, so so we're doing some work there. I've been very fortunate to be part of the Equity, Diversity, and Inclusion Task Force that you're co-chairing, which has been a really wonderful work to really try to target some of the more systemic issues sort of within the organization, which I've actually been able to draw upon a lot of that work from to my work at Brown. So at Brown, I'm part of the anti-racism research working group. So trying to make sure that that the research that we produce is anti-racist, right? To make sure that the research that we're doing isn't further reinforcing stereotypes or further harming the communities that we're studying. I've also doing some work within pedagogy, right, within scholarships, of trying to make sure that sort of things just really basic, like the classroom syllabus, right, to make sure that's anti-racist, to make sure that we're incorporating authors of color into our readings, to make sure that we're acknowledging non-Christian holidays for days off, right, to make sure that when the student needs an excused absence, that we don't need like a medical note because maybe they might not have insurance or transportation. So to really trying to sort of shift the frame around historical and traditional forms of education to make sure that we're attending to the diversity of students, right? Because we know that I think we have so many more students of color currently in college and in higher education. Yet sort of the further you go up the pipeline, the more white the leadership gets, right? So I think for presidents of universities, it's around 85% are white. And so, and for faculty, it's I think 10 to 15%. So there's a lot of work to be done within those spaces as well.
Right. And how, having people of color in those spaces also for these people completing the programs, because I know people will start and not finish because of the oppression that they experience in those programs. I've had, heard numbers of, horror stories from people just experiencing their graduate schools or their graduate programs as very oppressive. So having people that look like them in those spaces also allows them to kind of persist and continue and graduate.
Yeah, absolutely. Absolutely. Yeah, and having queer people within those positions as well as like further role
Right.
models, right? We know that
Right.
career research shows that people don't go into fields because there aren't people that look like them or that share
Mhm.
similar identity. So it's sort of the importance of that visibility and representation sort of the further up you go is yes, just really, really important.
Awesome. So I'm going to shift gears a little bit, because one of the things that, our goal here in this conversation is, again, to highlight your work, but also humanize you, right? Humanize therapists. Like, we have stuff too. We deal with stuff. We work through stuff. Some stuff we haven't worked through, right? There are lots of things that we're navigating as people.
Yeah.
And I'd love for you to share a personal struggle that you've dealt with, and kind of walk us through what the situation is, and then what strategies did you use to kind of help navigate that situation and get to a place where it feels resolved, or it's kind of within your window of tolerance that you can navigate that situation from a different lens.
Yeah, absolutely. I think the one that comes to mind is, right, so therapists also need therapists, right? So we're also in therapy. I see my therapist weekly. And it was with a white therapist that I was working with during graduate school. And I think Atlanta for me was probably the first place where I lived in a big city that had a big queer community. And I think
Mhm.
that created the space, along with grad school, to really start to integrate and really own my queer identity. So I was sort of starting to navigate all these different spaces and dating and building community and relationships that I was sort of sharing some of the struggles of that most queer gay spaces tend to be pretty white, and so I was sort of sharing the difficulties, right, of building community and relationships as a Latino male, and during me sharing, and she was trying to challenge me, but she said, "I wonder to what extent are you playing the race card?" Um,
Mm. This is your therapist
yes, my
in
therapist,
your therapy session.
my therapy session, sort of
Ooh.
to what extent am I playing the race card as sort of
Mhm.
an excuse for not building community or something, to where, yeah, that was just incredibly invalidating, and
Mhm.
I would say a rupture in our relationship, that I was able to name that in the moment, and we sort of worked through that, and I think that gave me a different perspective in terms of navigating whiteness, in terms of navigating um, difficult conversations,
Mhm.
um, and I think this is something we're seeing more and more now talked about, but sort of the importance of cultural humility, right? So making sure
Mhm.
that we're being culturally humble towards others to make sure that
Mhm.
that we let others be the experts in their lived experiences.
Yes.
Um, and so I think that was sort of a growth opportunity, probably for both of us, and I think that's sort of what sort of put me on my current career path to really make sure we're developing interventions
Mhm.
that are targeted and developed with and by the community. Um, and so I can share that sort of I'll be submitting an NIH grant in October, which is aimed
Ooh.
to develop a alcohol brief intervention that is focusing on the experiences of Latinx queer people and really
Mhm.
focusing on how those like multiple forms of discrimination, right? So we know
Mhm.
that queer people of color experience racism within the broader
Mhm.
LGBT community. We
Mhm.
experience heterosexism or homophobia from our communities of color or from our home community.
Mhm.
And so that sort of so targeting those intersectional forms of discrimination we know that leads to alcohol use. So part of the
Mhm.
intervention I'm adapting or creating is targeting those experiences of discrimination to target alcohol misuse.
Great. Yeah, thank you for sharing that. So powerful. And, you know, again, I always just really appreciate when people are able to share their stories, those experiences with us, because it's one, it's helpful to hear other people's experience, and also helpful to hear how you navigate those situations. And it's so interesting that you share, because part of me started InnoPsych has been for that, right? For that reason, how do we kind of elevate therapists of color in the field so people can find them? Um, and I recently applied to this program, and one of the feedback I got from one of the judges in written feedback, it was like, well, what is all this thing about color, and why do you need therapists of color? And I'm like, okay, thank you for that feedback. But it's like, I know why. And, maybe I need to communicate to you why, but maybe not. Like, but this is, and that experience is just an example of why, right? How when we're in spaces or in therapy, and people have shared that with me, that they've been in the therapy room and experienced, microaggressions from their therapist, or their white therapist working through their guilt with them in their therapy session. Is like, no, I'm not paid for that. Like, right.
Yeah.
So yeah, so important to, for this work, and be able to, for also part of the education is like, so people know, like, if that happens, like, you can leave, you can find
Right.
somebody else, right? You
Absolutely.
don't have to stay. Or that you don't think, well, therapy doesn't work, you never come back to therapy again, right? So
Absolutely.
really trying to shift those messages.
And I think part of that, right, is that us as therapists are also doing our own internal work, right, and also unlearning these
Mhm.
internalized systems of oppression, right. So there was an instance where I did misgender a client, right,
Mhm.
and I felt horrible and owned it immediately, but sort of we still mess up, right, and so I think being able to reflect a little and sort of start to unlearn some of those experiences is just so important.
Yeah. Yeah, and you're right. Absolutely. I do a lot of diversity, equity, and inclusion consulting. And one of the things I say is I leave the workshop is like, I've done a lot of work with this, but I am still learning. And yes, I definitely have made mistakes. But the point is not about making mistakes, it's what you do when you've been
Yes,
given feedback or when you recognize your mistake, right? It's about
absolutely.
apologizing right
Yes,
away,
yes,
listening to hear, and then doing better next time.
yeah,
So, it's, and even, I think even today, like, again, working in the high school, the language is changing so quietly. I think for a lot of the trans youth, I'm seeing this pattern of, you know, um, different patterns, right? But sometimes they come out with using they pronouns as they try to figure out, they're
right,
still trying to figure out their identity, where they're falling along this continuum. And one thing I've seen now is sometimes some of the students are using all the pronouns, or they may use like she and they, or he and they. And I made a full power where I said, well, which one do you want? And she was able to share with another teacher, was like, she made me choose. I didn't want to choose. And so I was able to get that feedback, and immediately went, apologize to the student. And then I was able to talk with my colleague. I say, I'm really, trying to navigate this and want to do right by students. And so help me think through, like, and I did say, I don't want to put that labor on you,
yeah,
but help me think through this if you feel comfortable. And he said, yes, absolutely, I feel comfortable. How do we help students? How do I help students kind of think about, is there a primary pronoun, or which one do they want to start with first, as a way to kind of get to that without making them feel like they have to choose one. So, I think as we're, the language is continually evolving, and we will make mistakes, but it's what do you do when you are given that feedback?
absolutely.
So, any questions in the chat? This has been a wonderful conversation. I am learning so much from this, and just again learning more about you. So, if you have any questions or comments, feel free to drop those in the chat as we start to wind down. So, my last big question is about
as we think about healing and about thriving, right? Our signature name is Thriving Thursdays. So what are your thoughts about thriving? What does thriving look like in our communities? What are some things that you're going to help promote that thriving and that healing for our communities?
Yeah, absolutely. And I think that's so timely, right? Sort of given that we started Pride
Mhm,
earlier this week, and I'm getting a little emotional, right? But sort of there's so much work to be done, and while also
mhm,
acknowledging so how far we've come, right?
right.
So sort of really holding. I think it, right. I want to give a quick shout out to sort of like the giants that we're standing on as the queer
Mhm,
community, right? So Marsha Johnson and Sylvia Rivera, who were part of the Stonewall riots, and sort of starting the LGBTQ civil rights movement.
mhm,
That I think there's so much to look past and sort of move forward. And so I think when I think about thriving, the word that comes to mind is resilience, right? Sort of resilience within the queer and LGBTQ community. Sort of, we're seeing all these really intense, like anti-trans laws currently happening.
mhm,
That
mhm,
a lot of them are sort of going and sort of happening during Pride as well. So I think that I think the community itself is just being really targeted in so many different ways. But I think um, there's a newer term that's coming out recently called positive intersectionalities, to where it's sort of where people are finding strength in their marginalized identities, which I
mhm,
think is such a powerful way to reclaim marginalization, and to sort
mhm.
of like reclaim our power within that space.
Right,
So a lot of the work that I do is from an empowerment sort of strengths-based approach, of sort of where, like, what resources do you have, and sort of how do we build on those.
right,
Um,
right.
and so I think when it comes to healing, it's sort of it's a it's a process, and I think definitely a tough one. But I think right, like sort of given like the HIV epidemic that we went through, that
Mhm,
we lost so many lives. And so I think the combination of resilience and sort of owning our power, and sort of owning and reclaiming just different words, right? Just the smallest things can be really, really powerful. So it's like the reclaiming of the word queer, right? Recently,
mhm, mhm,
over the past
mhm,
10 years has been really powerful.
mhm. Great, excellent. So, anything that you want to leave us with, whether it's a quote, a resource, a call to action, how, anything that you, or any last words that you want to give us
Yeah,
as we kind of round up.
yeah. I think I like the call to action, right? I think it's so important that we all serve as allies of of or the different communities that are being
Mhm,
and have been historically oppressed. So this is actually a quote that I got from that one therapist, right? That we had our cultural mishap, um,
mhm,
but to where which isn't to say like good work still can't be done, but a quote that they gave me was, "What is it that you can do that only you can do, that won't be done unless you do it?" And I want
mm,
to put that sort of within
wow,
the context of working towards equality and equity for queer people of color for this month.
I love that. So, what is it that only you can do? Say that one again.
What is it that only you can do that won't be done unless you do it?
You do it. Ooh, I love that. I'm gonna have to look that up. That is powerful. So, again, I want to thank you so much, Dr. David, for being here and for sharing your stories and sharing your journey with us. And, if there's any way that I can continue to support the work that you're doing, please do not hesitate to reach out. And I can't wait till you get licensed so we can feature you on the directory. And it's been so wonderful having you here in our audience. There any last questions? Anyone, anything you want to share? If you have a comment. Um, so someone is saying they firmly believe that straight supporters of LGBTQ people need to be more vocal in support. calling out misinformed people may hit differently from a non. Yes, it's absolutely, and we can make those parallels. You know, I know when I'm in spaces and there's something offensive that's stated, you know, I look around to see who are my allies. Am I gonna have to be the one to speak out, or someone's gonna speak out? So I think it's definitely, if we have power and privilege in those spaces, then we need to be vocal. Thank you for that, Edgar, for sharing that last point. So thank you again, Dr. David. Oh, we have, see, people are waiting to the last minute to bring their questions. I love it. Everybody's getting warmed up now. How do you navigate your sense of self at this current place of growth in your identity when there are folks out there, when there are folks trying to suppress your voice? Very powerful question from Debbie.
I think this is where the important part of community comes in, right? So being able, I think the past year has been a depletion of resources for so many people in terms of racial injustice, anti-Blackness, the anti-transness happening. So I think a lot of people are feeling really depleted, including myself. And I think that still doesn't excuse the need for us to be vocal within different spaces. And so I think trying to fill your bucket, right? So I know one way, Charmaine, shout out to you, but one of the spaces that fills my bucket is the Equity, Diversity, Inclusion Task Force for MPA.
That's awesome.
So really finding, I think, like-minded people that you can go to that's like, can I just be like, can I process something with you? Somebody said so, it's so thing to me, like I just need to make sure I'm not being too sensitive, or, you know.
And we're so quick to like downplay our gut and our instinct too, right? Like we know that stuff was wrong.
Yes, absolutely. Absolutely.
But it is nice to have someone to process it with, for sure. And how do I address it, right? Because sometimes if I just act on emotion.
Yes.
Right. How to be thoughtful in those reactions. Yeah.
So yeah, I'd say asking for help when you need it, and really trying to make sure that your bucket is filled, so you can sort of slowly start to refill other people's buckets when needed.
Right. I love that. And so this is my definitely last comment. So what are some things that you do to refill, or that you recommend for clients for self-care? What are some of your go-to practices for health, for healing and well-being?
Yeah. I think it's been hard during the pandemic, right? So I think that's also further exacerbated a lot of the self-care stuff. So it's sort of needing to be creative. So I know for me, I have a weekly Zoom happy hour with several of my friends that are sort of within the field, to try to really just try to process all of the things that are happening. So I as an extrovert, this has been soul crushing, working and living from home. So really finding new ways to fill my extrovertedness. And yeah, I think, I think it's a work in progress for me. I think self-care is hard. I think it's easier said than done. But I'm trying. Drinking more water.
There you go. Yeah. And, you know, I absolutely agree. For, you know, for some of us who are like, you know, for me, I'm like so passionate about this work, and I could go and go. And for me, I've had to like really kind of make my self-care be small and realistic, and focus on consistency, and not worry about having to do an hour at the gym 5 days a week. But if I can do a 15 or 20-minute walk or half-hour walk in my neighborhood with my daughter, that's what we've been doing. And some nights it's like, it's only 15. I'm like, oh, does it still count? I'm like, yes, it still counts, right? Yeah. So just keeping it small and realistic. And when I get out there, again, even if it's for 15 minutes, I'm like, okay, I did my thing today. I did the thing for me today. So I absolutely agree that it is challenging. It can be challenging, but if we kind of keep our goals, they don't have to be these huge dramatic goals. It can be very small pieces, and I think the consistency is key.
Yeah, no, I think related to that, right, is this sort of this self-compassion piece. I think also goes a long way within self-care. So sort of like, didn't make it out of the house today, and you know what, that's okay for today, but I'll try tomorrow.
Exactly. Tomorrow's a new day. Exactly. So I could literally keep going talking to you, David. And I can't wait because I don't think we've ever met in person. Have we? Oh yeah, we did when we used
Yeah.
to do the APA, yes. But I hope that we can get to connect and do some outings. I know Seema used to do more outdoor, meeting at restaurants and things like that. So, but again, this has been wonderful having this conversation with you. And I could see some of your people came on. They've been very polite, but I know they're your people. So thank you all for coming. And we look forward to next week. We have Dr. Anjali, who is a queer Indian psychologist who will be talking about her experiences in the field as well. So these conversations are so enriching for me and I learned so much. So I thank you all for being here. Have a good night, everyone.
Thank you so much for having me again.
Thank you, of course.